Hello everyone, welcome back to Med Made Easy. Today we're going to talk about common upper respiratory infections and other common illnesses that don't necessarily fall under the category of upper respiratory infection. Today I want to explain, before I jump into that, I want to explain just a little bit about upper respiratory infections, because I think some people get that confused exactly what it is. They think it's just the lungs, and really when it says upper respiratory, it also consists of the nose, the pharynx, and larynx. So that's important to understand that this is all part of that as well. So I want to go ahead and jump right into the first illness, bronchitis. Bronchitis involves the large airways, and a key finding about bronchitis is that often you'll hear wheezing with it. Rhonchi is another important thing that is characteristic of bronchitis. Rhonchi sounds, when you auscultate, it sounds like snoring. But typically, after the individual coughs, that will clear. And that's a key finding because in pneumonia, after the individual coughs, they may have some rhonchi, but after they cough, it's not going to clear. Rhonchi just indicates a temporary obstruction. That obstruction is typically caused by mucus. Typically, a viral illness, cold, or other upper respiratory infection precedes bronchitis. There is acute bronchitis and also chronic bronchitis. Typically, with the chronic bronchitis, there's this constant irritation that leads to inflammation in the bronchial tubes. And often, you'll see individuals who smoke or who have constant chronic exposure to secondhand smoke. They often develop chronic bronchitis. If an individual is getting recurrent bronchitis, it is important that they get evaluated for this because this could indicate that they have something called COPD, chronic obstructive pulmonary disease. The next illness that I want to talk about is COVID. COVID typically has three main characteristics, but there are many others, but the key ones are fever, cough, and dyspnea. Dyspnea means difficulties breathing. Another thing is that it often is associated with loss of smell or taste. That is a key finding that a lot of individuals have. One interesting thing is that there's not as much runny nose seen in COVID as in a regular upper respiratory infection. And sometimes you can have GI symptoms like diarrhea, is probably the most common one that we hear of when it comes to GI symptoms in COVID. Moving on to the next illness, pneumonia. With pneumonia, there's typically, you're going to see fevers, rales. Rales are a crackling, bubbling sound. And a lot of times it's unilateral. You may notice that there's decreased breath sounds or crackling on one side or the other. If it is viral pneumonia, however, though, usually it's going to be on both sides, and we can see that on x-rays. The individual may have what's called pleuritic chest pain. When they breathe, it seems like it makes it worse. And one handy physical exam test that you can do is called Egophony. And Egophony is basically when you are auscultating, you have the individual say EE, you're listening to their posterior lungs, and when they say EE, you hear actually A, and sometimes you may have to actually have them repeat it several times. That's a good indication of consolidation or pneumonia. A lot of times that is a thing that a lot of times we don't use enough as a physical exam, but when you listen, basically, instead of hearing EE that they're saying, you're hearing A. Also, tactile fremitus on physical exam is another way to determine if an individual, or help you to determine if an individual might have pneumonia. Moving on, strep. Most of us have had strep in our life, and we know how it is just a terrible illness. It's not fun to have it, and your throat just feels horrible. So some key characteristics and findings is usually a very high fever. Usually strep is not this, it's obviously sore throat, but it's not something that's going to get better, although I have seen some individuals who may think they're getting better, but it typically is going to continually get worse. Sometimes some individuals do have dizziness. Headaches are also a key find. And a lot of times in kids, they have more GI symptoms along with just kind of the fever and not feeling well. And then you look at their throat and of course it looks terrible. But they tend to have a lot of GI symptoms like nausea and vomiting. There's not usually a runny nose or cough seen with strep. Tonsils are usually swollen with exudates, and exudates look like these white patches that you see basically back there on the tonsils. Moving on to mono. A key characteristic for mono is that the lymph nodes are often very swollen, severely swollen. Often they feel like they have almost like golf balls under their neck area, and it's almost always the posterior cervical lymph nodes rather than the interior, which is often, you can see that with common colds. So, no, sometimes we'll see strep and mono together, and I have found that often the tonsils are almost even, they can even look worse than what you sometimes see with strep, and people are convinced that they have strep. Important thing to know is that if an individual is diagnosed with strep and they actually have mono but it was not diagnosed, if they're given things like amoxicillin, they will develop rash typically, and that's a good key finding. A lot of times it's mistaken for just an allergy to amoxicillin, but the clinician really should look into also testing for mono as well. Like I said, sometimes they can come together. Another key finding of mono is that the fatigue is extremely severe. And also, the individual may have left-sided abdominal pain from possible splenomegaly. This is why it's so important that these kiddos, typically kiddos, avoid any kind of contact sports, and also just be very careful about any kind of direct contact to their abdomen. Influenza. Now, influenza, the key characteristic about this is that the individual can almost tell you exactly the time, the minute where they were when their symptoms developed. It has an abrupt onset, and that's pretty distinct about influenza. It hits you suddenly, and often individuals will say, I feel like I got hit by a truck. They have high fevers. It's very common to have high fevers. Headache also goes along with it. Typically, it's going to be a dry cough versus a wet cough or a productive cough. It's usually be just a dry cough. They also complain of muscle aches, or myalgias is the medical terminology for that. And often the myalgias are sudden and severe. They do have, individuals with influenza sometimes do have sore throat. And another distinctive characteristic about influenza is that the runny nose, or the rhinorrhea, is extremely watery. In COVID, you're not going to see as much of that watery drainage as you are going to see in influenza. You might see a lot of congestion in COVID, but definitely not as much watery drainage as in influenza. Next illness I want to talk about is croup. Now, a distinctive key characteristic about croup is the barky seal-like cough. We hear that often. Now, croup, it's basically inflammation of the voice box, or the larynx, the windpipe, or trachea, and the bronchial tubes, or the bronchi. And so what happens is you get all the inflammation in there, and the passageway in that area becomes narrowed. And so because of this, you get that distinctive seal-like cough, barky cough. Their voice is usually very hoarse sounding. It's also accompanied a lot of times with a fever, and they may have really whistly or rough sounding breathing. Another thing is on imaging, on x-rays particularly, there is something called a steeple sign that is characteristic of croup. The steeple sign reflects basically a tapering of the upper trachea, and that's why they get sometimes that stridor sound. The final illness that I want to discuss today is epiglottitis. This is an important one because it is potentially life-threatening and needs to be recognized promptly, and the individual really should likely go to the ER. Epiglottitis can be caused from a lot of different things, but typically the most common cause of it is the Hib bacteria. And so this is something that usually kids are immunized for. But moving on and talking about some of the key characteristics of this. Stridor is a big one, so that whistling sound, drooling, sometimes a hoarse or a muffled voice, and you do not want to inspect the throat. You really should not put a tongue depressor. That's a key test question that you might see, but definitely do not examine the throat if you can avoid it at all. These individuals often have the drooling along with difficulties breathing and also swallowing, and they also may complain of a very sore throat, and they may also feel that you may notice that they're very anxious or restless. When they sit up or they lean forward, it seems like it's a little bit better. They may have a little bit less anxiety, but definitely those are all key characteristic signs of epiglottitis. On imaging, what is seen is what's called the thumb sign. That also might be another test question if you're in nursing school. Alright, well this ends this video for today. I hope you enjoyed this video. Put a thumbs up on this video if you do like these kind of videos, and make sure to subscribe.